6 to 9 a.m.
All right, it's Hot Breakfast. We're winding out Women's Month and I've looked at various facets of womanhood, of being a woman, some of the successes, some of the challenges of being a woman. And health in focus in Women's Month is something we've touched on a number of occasions. Also joined this morning by a specialist neuropsychiatrist, also a member of the SA Society of Psychiatrists, Dr Anersha Pillay. She's not only on the phone with us, but also on social media. And it's her take that we need a growing understanding and recognition of fibromyalgia as a genuine disorder and something that afflicts women in particular in this country. Dr. Pillay, thanks very much for your time. Very good morning. Thanks for joining us on Our Breakfast.
Good morning. Thank you so much for having me.
Absolute pleasure. Now, it's a very misunderstood condition and sometimes even misunderstood by people in the medical profession. It's almost as if, you know, if we can't categorize something, we just call it fibromyalgia. I've even had doctors refer to it as the sickness of being sick, which isn't what's the word, very understanding on the part of the doctors. What is it then?
So, Aidan, you know, fibromyalgia has been around for centuries, and because of, I suppose, the lack of a diagnostic test that helps us to diagnose it, it makes it quite difficult for people to understand that this condition exists. So what it is, it's a chronic condition. It's characterized by widespread pain in the body, together with a lot of fatigue. There's sleep disturbances, and there can be memory disturbances, so what we call cognitive features or cognitive fibro. And these patients are really quite severely distressed by this. In addition to that, there's a high percentage, up to 63% of patients who have psychiatric conditions as well, mainly depression, anxiety, sleep problems. And this is what makes the diagnosis often sent to psychiatrists until, you know, they are properly diagnosed as part of a medical condition.
So am I understanding you, it's less of a psychiatric condition than it is a physical one? Or are we dealing with almost a perfect combination of the two, though?
Sadly, it seems to be a perfect combination of the two, but the background of it is really much more medical than it is psychiatric. So the medical condition really is due to a problem with the body processing pain. So we have two mechanisms that process pain. One is how we perceive pain, and the other is how our body naturally deals with pain. So in fibromyalgia, the pain experience is amplified, almost like the volume is turned up. And the body then is unable to turn down the volume. So even mild pain is experienced as quite severe. Now, this is not to say that the patient is pretending or that they're exaggerating their pain. Their actual pain mechanism is not functional.
All right. It's I think we all have people in our lives who constantly are almost highlighting medical conditions, and people who suffer from fibromyalgia tend almost to be dismissed by society as complainers. I mean, how can you be in such pain? How can you constantly be in such pain? How can the pain shift from one part of your body to another on an ongoing basis? How can you be pain-riddled for years and still lead a normal life? I mean, that's almost the common experience of a fibromyalgia sufferer.
Indeed, you know, the impact on life is incredible. I mean, you can imagine if you're experiencing intense pain the whole day, that you're not able to function normally on a day-to-day basis. Getting up and going to work is arduous, and really managing socializing and all the other activities that make our life whole is even harder. So unfortunately, these patients are severely stigmatized and not recognized, and as such, they don't actually get to proper treatment. There can be a delay of up to 5 years before this diagnosis is actually made.
All right, and just talk to me about how that pain presents. Are we talking about pain that is as a result of an injury, or are sufferers likely just to experience pain that moves from one part of the body to another without something triggering it necessarily?
So the triggers can be after an injury or after some kind of major psychological distress. But the pain itself is not in one area. There's several tender points, which we call them, and they exist in above the abdominal area, below the abdominal area, and on both sides of the body. So it's quite widespread. It can be in the muscles. It can be in the junction between the muscles and the joints. So it's not a specific area as though you would have had an injury and that specific area would be painful. It really is all over the body. But together with that are severe headaches. There can be irritable bowel and bowel symptoms. There can be bladder symptoms. So, and in addition to that, some of the patients even experience severe jaw pain. So this really is a severely painful condition that is all over the body.
We just flagged on our social media, our live social media post, a message from Margot saying, I've had fibromyalgia for a few years. People don't understand how hard it is. Thank you for this. Why does it impact women so severely? I mean, there's a higher proportion of women presenting with fibromyalgia. We're having this discussion against the backdrop of Women's Month.
Indeed. So women are affected up to about 6 to 9 times more commonly than men are. So, yeah. Look, no one really knows because the cause of the condition is actually what we call idiopathic in the medical world, meaning that there isn't a defined cause. But the fact that women are more affected tends to lean towards the fact that hormones may play a role. Female hormones may play a role. Female genetics may play a role. It's even postulated that women play a greater multi-dimensional role in society, and that kind of strain of being a mother, of being a provider, tends to actually make the illness a lot more common in women as well.
All right. And is there the likelihood that with age, you flagged hormones as a potential trigger or sort of a starting mechanism? Does it get worse, or is there more likelihood of suffering from it with age?
Not necessarily. They tend to present within the ages of 30 to 60 primarily. Right. So that's where we see, you know, where hormones tend to be more at their most functional. And after 60s, when many women go into sort of the postmenopausal or perimenopausal stage. So the illness tends to perhaps present less virulently then. But you do see fibromyalgia even in childhood. So, you know, that does make us wonder what the role of hormones really is. But as I said, you know, in medicine, you get these idiopathic conditions, which means no one is really sure.
Anthea commenting, saying, fully agree. People often think you are pretending or saying things like you don't look like you are in pain. So yeah, I mean, it's misunderstood. It's almost trivialized by people who do not firsthand have an experience of what this is. I think two things, Doctor. We this morning have created a platform for people who are sufferers to be able to say, well, it is a genuine thing. And maybe now more people would be willing to step forward, certainly the ones listening and almost owning that space. What's your advice from a medical or a psychiatric point of view? What's the next step? Maybe there have been people who've been suffering in silence because the world doesn't believe them, where perhaps now something is switched on to say, well, okay, they're talking about it on the radio. There's an expert. What do they do today, tomorrow, to try and kickstart some kind of relief to what they're feeling?
Sure. So you know, there's a lot of literature into what treatments are available, and I think one of the most important aspects to look at is regular exercise. That seems to have shown really good effect in trying to manage the condition. It has to be consistent. And it can involve aerobic exercise or even just stretching exercises. In addition, there are very specific medications that work on fibromyalgia, and these tend to be antidepressants with pain relief. They tend to be the anticonvulsants or antiepileptic treatments, specifically one called pregabalin, and then tramadol as a pain relief. This is particularly if the pain experience is quite severe. Remember, this condition can vary from mild to severe. And then for the psychiatric component, I do believe very strongly that sufferers should seek psychiatric help if they are suffering from depression and anxiety, and particularly memory problems. So there are things that can be done. The most important thing is for people to go to, you know, clinicians that have an understanding of the illness and have empathy and are able to kind of manage them going forward.
All right, Dr. Pillay, I'm looking at some of the comments that are pouring on through. Thank you very much for this discussion. This is so powerful and uplifting. I mean, there's a lot of that kind of reaction. So thanks very much for your time. I think it comes at just the right time for many people who almost were at wit's end. And hopefully that, particularly that advice that you dispensed at the end, is what people are going to take to heart. So thanks very much for chatting to us. You have yourself an awesome Monday further.
Thank you so much, and same to you. Thanks for having me.
All right,
Bye-bye.
that is Dr. Anersha Pillay. She is a specialist neuropsychiatrist. She's part of the SA Society of Psychiatrists, talking to us